What motion does the extensor hallucis longus do? Extension of the big toe. What else does it do?
Inversion?
Why does it assist with inversion?
Because it's on the medial.
Yeah, it's on the medial side, okay? What else does it do?
Plantar?
It assists with dorsiflexion because it is in the anterior compartment. You guys, that's awesome, okay? So we know that all these motions that the extensor hallucis does, but the motion that I would primarily assess for manual muscle testing is I'm going to put their foot there, and I'm going to bring their hallucis down, and I'm going to ask them to bring their toe up. Okay, relax for me. You see how her toe bent at the phalanxes? So at that point, what I'll do is I'll just come down here. Now go ahead and bring your toe up. And now I can get a better test there. So that's my manual muscle test to really isolate the extensor hallucis longus, all right? Now, remember during resistive range of motion, what's gonna make us want to do a manual muscle test on this?
Weakness.
Weakness in what motions?
Dorsiflexion.
Dorsiflexion, inversion, okay? And if we assess range of motion, resistive range of motion of the toes, we'd obviously have weakness there with extension, okay? Digitorum, next.
Yep.
Extensor digitorum, okay? All we're gonna do here is take her foot, stabilize it. I'm gonna bring her toes down like this and have her bring her toes up. Okay, good. And you guys remind me, how do we know if she has weakness? I just wanted to spread Ashley's feet with you too.
Sorry.
Huh? We'll both go wash our hands after this. Okay? Exactly. All right? What's our next one?
Tibialis anterior.
Tibialis anterior. So we know that tibialis anterior does what motion? Give me one motion.
Plantar flexion. Dorsiflexion.
Dorsiflexion? What other motion does it do? Ashton?
Eversion? Inversion? One of
Which one of those? You're right, it's one of them. Remember this. The tibialis anterior is running like this.
yeah, it's inversion.
Yeah. Okay. And why?
Because it inserts medially.
Nice job.
Okay, thank you.
Okay, where's the confidence? You're
Okay,
right.
Good job. You got it. Okay. So what we're gonna do, Ashley, if you don't mind, slide down here
Yeah.
just so I don't
Okay.
hurt your foot. So what I'm gonna do is I want to assess this motion. Okay. Remember, we have two options here. We can do what's known as a break test, which is where I'm gonna put her tibialis anterior in the shortest position possible. Okay, which is right here. And then I'm gonna say to Ashley, don't let me pull you out of that, okay? And then I'm gonna try to pull her, and I'm pulling at this angle, okay? The other option that I have is to assess both those motions as I go through the full range of motion. So relax for me, Ashley. I'm gonna put her foot here, okay? And then what I'm gonna have Ashley do is this motion here. And I'm gonna resist that, okay? Ready, go? Good, all right? I don't care which one you choose to do, I would suggest to you that you pick one and you stick with it. Whether you wanna put the muscle in the shortest position, or whether you wanna put it in the longest position and then assess the full range of motion, it's your choice.
Could you do both?
You can do both.
You'll still have to compare bilaterally for both of them.
Always compare bilaterally,
Okay.
okay?
Next one is tibial. Oh, peroneus tertius.
Which one do you usually use and why?
I typically will do the last one,
Okay.
where I'll assess through the full range of motion. But the break test is probably easier for you guys to remember initially. Okay? Because Hannah, what you're really doing is, do you want to put the muscle in its shortest spot position or length, or do you want to put it in where it's at its greatest length? Okay? Greatest length, we got to assess the full range of motion. If we go here, now we're just assessing it in that one spot. I will do both, but I typically will do the last one.
Peroneus tertius.
Peroneus tertius. Okay? Michaela, what is one motion that the peroneus tertius does?
Eversion.
Eversion. Hannah? Dorsiflexion. Okay? So if I want to do the break test, I'm going to put them in that position. And then what I'm going to do is I'm going to grab the lateral aspect of her foot. And I'm going to say, go ahead and hold it there. Don't let me pull you out of it. Don't let me pull. Nice. Okay? Relax for me. Now if I want to do it through the full range of motion, what I'm going to do is I'm going to go here, and I'm going to say, this is the motion I want you to do as I resist you, okay? Ready? Go. Keep going, keep going, keep going, keep going. All the way through, all the way through. Okay, relax. Do it one more time. All the way through. There you go. There you go. Good job, good job. Good. Okay. Next one.
Tibialis posterior.
Tibialis posterior. Ashley, tell me one motion that the tibialis posterior does.
Plantar flexion.
Does plantar flexion. Ashton?
Eversion.
Be confident.
Eversion.
Eversion? You're close. It's inversion. And why is it inversion? Remember, tibialis posterior is Tom, Dick, and Harry. And that compartment, the deep posterior compartment, all comes down on that medial side. Okay? So we're going to assess inversion and plantar flexion. All right? So if I want to do a break test, I'm going to put her into inversion and plantar flexion. Okay, just like this. And what I'm going to say is I'm going to say, Ashley, don't let me push you out of it. So what I'm going to do, relax for me a sec. I'm going to try pushing you like this. Okay, you keep your foot right there. Ready? Go. Okay, all right, relax. Now, if I want to do it where I'm doing the full length, I'm going to go from here. So Ashley, you're going to start in a dorsiflexed, everted position, and we're going to go down into a plantar flexed and inverted position. Okay, ready? Go. Whoa, you got some strength there. Okay. What's our next one?
Flexor digitorum longus.
Flexor digitorum longus. All right, you guys, I'm not going to insult you guys' intelligence on this. You know what we did with the extensors? That's what we're doing with the flexors. Except we're going to resist flexion of the toes instead of extension. Okay, next one.
Flexor hallucis longus.
Same thing. You guys got
Big
that.
toe.
Okay.
Peroneus longus.
Peroneus longus. All right, so Michaela, give me one motion that the peroneus longus does.
Eversion.
Does eversion. Ashton?
Plantar flexion.
Plantar flexion. Nice work. Okay, good job, you guys. So if I want to assess the peroneus longus, my option for a break test is I'm going to put her into an everted and plantar flexed position. Okay, so she's going to be right here. All right. What I'm going to do is I'm going to take, and I'm going to try, just relax for me. I'm going to try pulling her foot this way. Okay, so it's everted and plantar flexed. I want to pull her out of it. Okay, so here we go with that one. Hold this. Oh, nice. Peroneals are good. Okay, now if I want to do range of motion, you know, through the full range of motion with resistance, manual muscle testing, what I'm going to do is I'm going to start her here. We're going to go from a dorsiflexed inverted position to a plantar flexed everted position. Okay, ready? Go. There we go. Good job, good job. All right, next one.
Peroneus brevis.
Peroneus brevis. So peroneus brevis is going to be the exact same as the peroneus longus. All right. Some people would say that the peroneus brevis is not as much of a plantar flexor because of where it inserts on the styloid process. Okay. So just realize if you don't want to assess plantar flexion, all we're doing is we're truly assessing really eversion. So if I want to do a brake test on the brevis, I'll have her foot everted, and I try pulling her out of it. If I want to do, relax for me, if I want to go through the range of motion, I'll take her from here to here. Ready? Go. All right. So if you guys notice, the difference between resistive range of motion and manual muscle testing, with the exception of the digits, is we're doing a diagonal motion.
Instead of just one motion.
Instead of a uniplanar motion, we're doing diagonal motions where it's involving multiple motions.
Okay.
Okay?
So, whenever you're like, if a patient, if you're trying to tell the difference between those, would you just ask like which motion they had most pain with, and that would tell the difference between longus and brevis?
Yeah. And when we're doing manual muscle testing, what we want to be feeling is which one of these is weaker.
Okay.
So resistive range of motion and manual muscle testing is all about weakness. Okay? We can use pain, the patient's pain as a guide, but it's more about which one of these is producing the greatest amount of muscle weakness.
And
Okay.
if it's weak bilaterally, then it's not.
If it's weak
As in,
bilaterally,
big deal.
that means that they're equal.
Okay.
Yeah.
Good. So,
Okay? So that means that it would be normal for that patient.
okay. Gas shock.
Gastroc.
Do I need to be on my stomach?
Nope. So the gastroc, all you're gonna do is you're gonna take their foot and go just like this, and they're gonna push against you, okay? So if I'm gonna do a brake test, we're gonna start here, okay? So Ashley, go ahead and hold it there, and I'm gonna try to break her out of it, okay? Relax for me. If I'm gonna take her through the range of motion, I'm gonna start with her foot in a dorsiflex position, and Ashley's gonna push against me, okay? So this one is a lot like, not like just resistive range of motion. Ready? Go. Okay. There we go. Relax. Now the next one's soleus, right? So the biggest thing that we have to do is we have to differentiate between the soleus and the gastroc. You can go ahead and flip over. And the way we're gonna do that is by shortening the gastrocnemius. All right, so relax. So what I'm gonna do to shorten it, remember gastroc heads attach up here in the posterior aspect of the condyles of the femur. I'm gonna take and bend her knee to here. So now the gastroc is shortened. So now, if I have her in a plantar flex position and I try breaking her out of it, I'm really assessing the soleus. Okay? But if, relax for me. Yeah, you do have some weird things with that foot. You notice how her foot's it's in like in a plantar flex position already? That's not normal.
It might have been my fins. They were heavier.
Okay, so what I'm gonna do here to assess the soleus is, Ashley, I'm gonna just push you down like that. Okay, so hold it. Good, relax. Okay, now if I want to assess like through the range of motion, what I'm gonna do here is I'm gonna have Ashley go ahead and plantar flex. Okay, because the gastroc is shortened, most of her plantar flexion is coming from the soleus at that point. Okay, and remember the plantaris actually inserts on the posterior aspect of the condyles too. So the plantaris is out of it with this one. So in order to differentiate between the gastroc and the soleus, all we're doing is bending it to get this gastroc out of it. Okay? What's our next one?